Good evening. Thank you so much for watching HealthLine here on PBS Fort Wayne. I'm your host, Mark Evans. Tonight, we're going to talk about something very important, especially these days, diabetes, and along with that, foot ulcers, the prevention and care. So if you or someone you know and love has diabetes and or foot ulcers, this will be a show to watch. And we have a very special guest tonight, Michelle Diss, who is a nurse practitioner. Thank you for being here. And we talked before the show that you look familiar, but we boiled it down to the fact that I've seen you on with Sandy Thompson on one of our other programs, Life Ahead. Yeah, so it's nice to have you here on this set, and thank you for being here this evening. Very important topic, but I want to talk about what you do for a living. Your title as a nurse practitioner. Can you tell us how did you get to that position, what it takes, and how do you differ from, say, a registered nurse?
Okay. Well, a little bit different. Nurse practitioners are master's prepared. So we have that master's degree along with several hundred hours of clinical time with another provider. That can be another nurse practitioner or a physician of some sort for our training. So while we're going through our education, we're also getting clinical time treating patients and learning how to diagnose and order imaging and prescribe.
And would you be considered more of a physician's right-hand person more than maybe a registered nurse? Would you maybe an upper level? Or I know that they're all so important.
Well, nurse practitioners have a collaborating physician, so I have a collaborating physician that I work with closely who kind of oversees what I do. But nurse practitioners are independent providers, so we can prescribe, we can diagnose, we can see patients by ourselves. Within the healthcare systems, though, a lot of nurse practitioners function differently depending on their specialty.
Okay. In fact, I just saw a nurse practitioner last Friday for this cold thing I've got going on that just won't go away. She was excellent.
Great.
And yeah, she was subbing for the doctor that day. So, but I felt like I got very adequate care. So
Great.
Thank you for what you do. Let's go ahead and move on. And before I do that, I want to go ahead and plug our phone number because it is an open concept, open arena show, if you will. 866-969-2720. That's the number you can call to ask your question or questions. And please do that in the next 30 minutes. Of course, you know, we don't stop down because we're not commercial TV. We are public television. And thank you for watching tonight. So, Michelle, let's talk about diabetes in general before we get into the foot ulcer thing. Can you provide some stats about how many people in America that diabetes is actually affecting?
Yeah, of course, quite a bit actually. I just read recently that it's about 9% of the population.
9%?
9%, so that's quite a bit. And we're diagnosing it earlier in age too, so even into your 30s or before that, we're seeing diabetes. I did read that there's over 37 million Americans that are diagnosed with it, and then there's an additional 1 to 2 more million diagnosed each year.
And what is causing it?
Oh, I think it's a lot of things. It's our fast pace of life. It's the fast foods and the processed foods. A lot of our jobs and daily activities aren't real mobile. We're not moving enough. So I think a lot of it is just based on the busyness, and we need convenient things, but those convenient things aren't always healthy for us.
Right. And there's not just one type of diabetes, but 2, or is there 3?
Really 2. I am by no means a diabetes expert, but I know how it affects what I do. But typically there's a lot of subcategories, which I would defer to endocrinology, but for sure diabetes type 1 and type 2. But diabetes type 1 is more of a congenital or a very early diagnosis. So as an adolescent or even at birth, you would be diagnosed with type 1, which is a lot more tricky to treat.
And type 2 is the adult onset?
Correct.
Okay, and is it hereditary?
You know, there's more and more research about that. I do believe there kind of is a connection to it for sure, but then there's a lot of outside influences too, like I mentioned, our diet, our lack of activity, the types of foods we prefer.
Okay, and let's talk about, before we get into the foot ulcers, we know that is one of the complications, but what other complications can diabetes bring on to someone?
Well, it can really affect most of the systems. You know, it can affect your heart and heart disease. It's really a vascular disease is what I've kind of learned. So diabetes affects your microvascular system, so your vessels that provide circulation. It affects your neurological system, causing changes in the nerves, so your sensation changes. It just about affects every system.
Wow. Okay. So let's go ahead and slide into the, as we've got a call coming in, but we'll get that in just a second. Slide into the foot ulcer issue. What exactly are those? Can you describe what they look like and what causes them?
Okay. So a diabetic foot ulcer is usually just, it's typically on maybe the bottom of the foot or the side of the foot. It can start for a number of reasons. It can be that maybe a patient stepped on something, and as I mentioned before, diabetes kind of decreases your nerve sensation, especially in your feet, so a patient may step on something and have a sore that then doesn't heal because maybe their blood sugar is a little bit too high. It could be related to improper fitting footwear, too big or too small. Especially if you have swelling in your lower extremities, you may see that a foot, a shoe doesn't fit you the same every time. Mm-hmm. So there can be a lot of factors. It can start out as trauma, and then it doesn't really heal because the blood sugar is not controlled.
So the blood sugar is the key. In fact, I've got a couple of questions regarding that later on in the show.
Okay.
We have a call coming in, and Paul prefers not to be online, and that's quite all right. You can either speak it yourself or we can read it for you. But Paul is asking, what does pre-diabetes mean? And that's a great question, Paul.
Yeah, that is, again, I would defer to probably endocrinology or even primary care, but prediabetes is a condition where you're sort of headed towards diabetes. So meaning your blood sugars may run a little higher than average, meaning your insulin levels your pancreas is secreting more insulin to control your blood sugar. So there's actually kind of some criteria that helps you meet prediabetes. So there's some lab levels and things like that primary care can help you determine, but it sort of means you're headed towards diabetes if you don't make some simple changes in your life, like exercise and diet, things like that.
Okay, is there a certain BMI in somebody that you'd have to watch for? What is it, the body?
Yeah, I mean, over 30, you're starting to have some excess weight. BMI is kind of a hard thing just because it's not,
it's different for everybody.
It really is,
yeah.
So that's not the only single thing that you can look at, but if you're having some extra abdominal weight, you're probably, we tend to store there, and then it's harder to control our blood sugar.
And getting back to the foot ulcer, I had a grandmother who had those, and they were just terrible. There were some days that she could walk and some days she couldn't. Mm-hmm. So why is it important to get care as soon as possible?
Really, it's the risk of infection.
Okay.
When your blood sugar is high, your body is kind of in a state of chaos, meaning it's trying to do a lot of things at one time. And if your blood sugar is high, your immune system really can't fight off bacteria the same as someone who's not diabetic can. So you have a better immune response with the blood sugar that's controlled.
I see. Now, I think you touched on neuropathy, or we're heading that direction a few minutes ago. What exactly is that, and how could that affect foot ulcers?
The main thing with neuropathy, so as I said, if you have a prolonged period where your blood sugars are not controlled, they're higher than normal, it kind of affects the way your nerves sense things. So oftentimes a diabetic patient may not be able to feel their feet at all. You could touch the bottom with, an instrument or your finger and they wouldn't feel it because that's neuropathy. Mm. So those nerves have deadened over time. So that puts you at risk because if you put on, that too small of shoe or something like that and it's rubbing, or you step on something sharp because you're walking around at home with no footwear on, you don't know it. And I've had many patients that come in and have they've had a foot ulcer for much longer than what they realized because you can tell with the amount of infection and damage there.
Oh, and I know we're talking a lot about adults here, but can children get foot ulcers as well?
Oh yeah, especially like we mentioned, the diabetic type 1 patient. Diabetes type 1 is very, very hard to control. And there's definitely a difference between the two, but that immune response in those type 1 diabetic patients is just really suppressed. It's much harder to control. So for sure, if you've got, a congenital state of diabetes type 1, they could get an ulcer.
All right, and I want to remind our viewers that our phone number is 866-969-2720. We're speaking to Michelle Diss, who is a nurse practitioner. Of course, the subject tonight, diabetes and foot ulcers, the prevention and care. So give us a call when you can. So you think you've got a foot ulcer, or maybe one of your family members says, Mom, Dad, you might want to get that checked out. What are you looking for? I mean, can it be mistaken for a mosquito bite, or I mean, is it going to be kind of bloody, maybe some pus in it? I mean, what
Surely
describe
it could
that?
be.
I would suggest giving us a picture, but it's probably not something we want to see.
It may not. It can start out just as redness, or often a diabetic patient gets a callus because their step has changed, so they have different pressure points, and that's just a result of the uncontrolled diabetes. So if you have a specific pressure point that continuously rubs in your shoe, it can form a callus, which is just thick skin. And often you'll see a diabetic patient, when you get friction in between the layers of the skin, they'll develop an ulcer or a fluid collection there. So it can start out as just redness. It may or may not have pain because maybe the patient can't feel that.
Mm-hmm. But if they do have pain, are they going to be painful?
Yes. Mm-hmm.
Oh, I see.
Yeah. And sometimes that pain, we call it neuropathic pain because nerves are kind of sharp and shooting. So if you've got patients with other health conditions, maybe a back injury or something like that, and they combine that with diabetes and neuropathy from that, you can have different types of nerve pain, which can be very painful.
I would imagine. Now, you suspect that you have a foot ulcer. What's the first thing you ought to do? Who should you call?
You can start with, your primary care physician. You can start with a walk-in clinic. First and foremost, I would just suggest cleaning it up and covering it with some sort of bandage or Band-Aid.
Well, I was going to ask you that eventually too, that if you've found a foot ulcer and you need to get some care and you've got an appointment to see the doctor, how are you going to care for that until then?
Yeah, simple stuff. It's keeping it clean and covered. And then trying to figure out, what else is going on. Is it your footwear? Did you step on something? Is there a foreign object in your foot still? That can happen as well, So, but if you want to go back to the first part, it's kind of cleaning it up, keeping it covered, and then making a phone call to either see primary care, going to a walk-in clinic. A lot of wound clinics are self-referrals. They're specialized now, so you can do any of those things. But you do want to try to do it pretty timely.
Mm-hmm. I would imagine those things can get really infected. What is the result with an infected wound ulcer, foot ulcer? What can happen?
Okay, well, there's first you have delayed healing.
Okay.
So you're going to have delayed healing, and that bacteria can just destroy more and more tissue going deeper into the foot. So a lot of times we do call that cellulitis. So you may see, your primary care, or you go to a walk-in clinic and they're going to see some redness, or maybe there's some odor or some funny looking drainage, or something like that, and they're going to put you on antibiotics. But then you have to figure out, why isn't this healing correctly? So you go back to the drawing board and sort of dig deeper, see a wound clinic, something like that.
I see.
Deeper infections, again, like antibiotics will help it, but you still have to do kind of your part, again, making sure that footwear is good, making sure you're keeping your blood sugars controlled, because if not, you can end up, in the hospital requiring IV antibiotics. And then in more severe cases, diabetes, those patients can develop what we call gangrene, requiring a surgical
amputation, possibly?
Mm-hmm.
Oh, man.
Surgical intervention and even amputation.
So even more importantly, you need to get this checked out as soon as you can.
Correct.
All right, let's go back to the telephones now. We have Kim on the line. Actually, she doesn't want to be on the air, but she's asking, does exercise have any effect on diabetes after being diagnosed?
Yes, because again, when we're active, our body is just functioning better. So it doesn't have to be anything real strenuous, but we encourage a lot of our diabetics to walk. As long as you've got that good footwear. That's the tricky thing about our diabetic patients. If you don't have the good footwear, exercise can almost bring on more complications. So you have to be careful. But moving is healthy for our body. It promotes circulation, And as I mentioned earlier, diabetes is also a microvascular disease. So all the small blood vessels within your feet and your toes, those can easily be affected, and the circulation can be decreased when you have diabetes. So when you get moving, you're promoting that blood pumping, getting circulation going, and you're going to feel better.
Yeah, that makes sense. Makes sense.
Yeah.
So get off the couch and do something. Get
Yeah.
walking.
Correct.
Yeah. All right. So what is important? This can go several directions, but you need to control certain aspects of your life. And what is important to control if you have these foot issues? As far as, you have to be watching your, when it's diabetic related, you have to watch your blood sugar, I'm sure.
Yeah.
And there's monitoring and equipment for that. I'm sure that people are very familiar with that. So what are you looking for there? Do you have any boundaries that you need to keep it within?
What I tend to say is you want to keep a blood sugar around 150. That can be challenging for diabetics, but your body is going to be able to tackle things better, and you're going to be overall more healthy if you've got a blood sugar level around 150. The other important thing for all diabetic patients is just checking their feet and their skin. Because you want to stay ahead of the game a bit. You want to prevent the ulcers. So if you can be looking for dry skin that cracks easily, on your feet and heels, that can be one of those things that turns into an infection for a diabetic patient because their blood sugars aren't controlled. So it's really just watching really closely, taking good care of yourself, moving, and controlling that blood sugar.
And it's not only the feet that possibly can't heal as quickly. It's like if you've got cuts, any type of lacerations, things like that.
Correct, yeah, it can be a surgical wound. A lot of our patients that maybe have, trauma or involved in a wreck of some sort or have an emergent surgery, they're going to be less likely to heal after a knee replacement or, after a hysterectomy. Any of those number of surgeries, you're going to have delayed healing is what's going to happen anywhere.
I see, the delayed healing. All right, so you've brushed over some of these things, but I'd like to encapsulate a little bit more. Once diagnosed, what's necessary to promote the healing process for the foot care?
Okay. Usually you're going to have pretty close follow-up with the provider that's treating the ulcer. Again, you want to have a really controlled blood sugar, so that would be around 150. I think your body can kind of handle things if you're under 200. It's got less tasks to do at one time. So goal of 150 to 200. Really good foot care, keeping the wound clean, following the instructions of the provider who's treating you. And then again, we're going to go back to that really important thing of just good footwear. And that can be, following up with a podiatrist who looks at your feet annually and maybe does a neuropathy test to tell you how well your sensation is doing or not doing. Many times podiatrist or even the provider that is taking care of your diabetes, you can work with them annually to get diabetic shoes and orthotics and then be fitted specifically. So you'll have what's called a podorthist or a foot specialist look at your feet and fit you for the best shoes that you can be in, and then with inserts that are replaced 3 to 4 times a year to help you not get the ulcer to begin with.
I see, and then you should definitely go back to see your provider to get checked up on it. And how often should you do that?
For diabetes or just for a foot ulcer?
Well, let's do both.
Okay. Well, diabetics, if you're pretty well controlled, I'm going to guess you're going to be seeing your primary care or endocrinologist, at least 1 to 2 times per year.
Okay.
If you're not controlled and you're not at goal and your blood sugars are up and down, it's probably going to be more frequent than that because there really are a lot of great medicines that are helping people control their blood sugars, lose the weight, get moving. When you lose the weight, you can get moving more easily. So if you're not controlled, I would guess you're going to be seeing your provider maybe every 1 to 3 months. If you're controlled, follow-up on diabetes is pretty important for lab work and other testing 1 to 2 times a year for sure.
Okay. We have a call coming in from Peter, and he's asking, are people with diabetes allowed to drink alcohol?
Good
It's probably not a
question.
good idea, right?
Well, I don't want to say you can't have any fun, but definitely in moderation because A lot of the different alcohols have a high sugar content, and so there are. I don't want to say you can't, but I would definitely keep it in moderation, because most of them just aren't good for diabetics, really, any of us. But you might want to specifically talk to your provider about that, because I would definitely say in moderation for sure.
And that word moderation, I'm sure you've heard it 1,000, maybe 1,000,000 times.
Yeah.
And you've preached it yourself, I'm sure.
Yeah.
Let's talk about, oh yes, I was going to ask you when you were talking about neuropathy, is that reversible?
Good question. Your nerves can regenerate, that we know. I've seen patients sort of regain some sensation in their feet as they get their blood sugars controlled. I don't know that it's 100% though. So more to come probably on that. But there does seem to be some sensation that returns in some people.
And probably based on the severity. Yeah,
correct.
Okay. All right. Very good. I'm glad I remembered to ask that. Let's talk about nutrition. Now, of course, want to keep the sugar level down and all that, but are there other things that you should be eating or should not be eating when you have diabetes?
Mostly protein, so if you can find good proteins, and it can be kind of tricky to find good proteins, because a lot of our labels on our food, they make you think it's a good product and a healthy product, but it's not necessarily that. But healthy meats, seafoods, things like that are always good, along with like a high protein, lower carb vegetable choice. So you want to avoid the processed foods and the things that are notably high in sugar, but you also have to remember there's kind of good carbs and bad carbs. So, if you think about that, sugars are a carb. So when you go through your diabetes education, typically prescribed by the primary care or the person who diagnosed you with it, you will learn the difference in the good carbs and the bad carbs, and that's really important to remember, because carbs are carbs at the end of the day, and they require more insulin to digest and keep your blood sugar controlled.
All right. And at the beginning of the show, we talked about how prevalent diabetes is these days. When I was younger, even as a kid, people who got, once in a while, you'd find, like one of my schoolmates would have the type 1 diabetes.
Yeah.
And actually, back then, to me, it was kind of rare. And the kids had to have their injections, the parents had to give them injections and things like that. I always felt sorry for those kids. But you gave us some stats at the beginning of the show. About 9% of America has diabetes, whether it's type 1, type 2. Most of it, I'm sure, is the type 2 adult onset. So why, besides the sugars and all that, why are the younger people getting the type 2 type of diabetes?
Well, I think it kind of comes back to what we talked about. I think it's our food choices. We have a lot of fast food choices, high carb foods, and I mean, if you think about it, the high carb foods are really good, but you have to, again, make good choices and do some of that in moderation. Enjoy a little bit, but don't go overboard.
Okay. What about the sedentary lifestyle? A lot of gaming going on, a lot of TV watching.
Yeah.
The computers.
I tend to say just keep moving, because there's a lot of things that happen when you don't move. You're probably gonna gain weight. Your vascular or vessels, your circulation decreases. Arthritis sets in. So all those things are really important. If you can get up and move every day, you can still enjoy some of the gaming or the good TV shows, but you need to incorporate exercise into your daily routine as well.
Okay. Bays has our final question for tonight. How many different machines or apparatus are there to check your blood sugar?
That is a great question. I couldn't tell you a specific number, but they are coming out with amazing things to continuously monitor your sugar. You can do it through your cell phone.
Yeah, and what is that? You stick something on your skin?
Yeah, you just got a little sensor there.
But there's no needle there, right? It's just
well, there's a little catheter. So,
okay.
And I apologize, but I don't know. Each product might be a little bit different on how often you replace that. Some of them are a couple of days, some of them might be longer than that, but it's much more convenient without the needle sticks. And it connects to your phone. A lot of the apps will tell you when you have a high or a low. So they have come out with so many great things that you can talk to your endocrinologist or primary care about, because it's not fun to poke your finger
No.
3 to 4 times a day or to recheck if you're having a low. So
Yeah.
there's so much technology out there that
They've
is
come
helpful.
a long way, haven't
They
they?
absolutely have, yeah.
I think we've got about 30 seconds left. Some take-home points for our audience. How can you prevent diabetes? And I know we talked a little bit about this
Yeah.
throughout the show, so lump sum it for us.
Yeah, it's just keep moving, keep exercising, try to make good choices on your foods. Educating yourself. I think going online and looking for healthy food options is really important because we don't always realize that we're making a bad choice, based on the label. So keep moving, make good choices, and try not to overdo it in one category.
And see your doctor regularly.
Absolutely.
All right. Michelle Diss, nurse practitioner, thank you so much for being here tonight.
Yeah,
Very
thank you.
informative. We got to have you back again.
All right, thank you.
All right. Thank you for watching. And another show coming up next Tuesday at 7:30. Until then, good night and good health.
The preceding program on PBS Fort Wayne was made possible in part by...
It's a new day at Parkview. Another day to rise up and make life better for those around us. Whether that means pushing the boundaries of what's been possible, taking big strides, or sitting with a patient long after a shift has ended. At Parkview, we don't just do what's expected. We do what's best for you and your family. And we're determined to do it even better tomorrow. Every person, every day. That's the kind of healthcare we believe in. Parkview Health. We believe in better.